My name is Christodoulos Kaoutzanis, and I'm an assistant professor plastic and reconstructive surgery at the University of Colorado. I also work with CU Medicine, breast surgical oncology. My father is a cardiothoracic surgeon, and as a result, I was introduced to the medical field early in my teens. First time that I was allowed into the operating room, I saw my father performing open heart surgery. I was mesmerized, and after that I spent time in the operating room and the wards, especially during the summers, and I learned early on how rewarding a career in surgery could be. The operating room, the team effort, pace, the expectation, the endurance, and most importantly, the priceless reward that you can get from positively impacting someone's life. Every year I felt I was more drawn to realization that I found a profession to which I could dedicate my life, and here I am today. I perform both aesthetic and reconstructive surgery. My clinical areas of interest and expertise include breast reconstruction, aesthetic surgery, gender-affirming surgery, and reconstructive microsurgery, including the surgical management of lymphedema, as well as some general plastics. I reconstruct oncologic defects, traumatic defects, and even congenital defects throughout the entire body from head to toe. I also perform cosmetic surgery of the face, eyes, neck, breasts, abdomen, body, and genitalia. And I also work very closely with a multidisciplinary team to provide the whole spectrum of gender-affirming surgeries, both feminizing and masculinizing. And I always try to stay up to date with the latest and most innovative techniques so that I'm able to provide best care for our patients. For aesthetic surgery, it is fairly straightforward since patients should look for qualified plastic surgeons performing the procedures these patients are interested in. Reconstruction is obviously different. When you come into the aesthetic office, it is not because you need something, it is usually because you want something. But when it comes to reconstruction, it is not as straightforward because we offer many reconstructive procedures for a variety of issues and defects throughout the entire body. We treat acquired defects and congenital defects, and those can be related to trauma, cancer, or even other conditions. And we collaborate with a lot of other specialties, and it's not uncommon for other specialists to refer patients to us to assist with these types of reconstruction. And that's why it is important for plastic surgeons to educate their communities and colleagues about the available options to treat all these conditions. I always try to provide safe, compassionate, very comprehensive, and modern advanced care in the most comfortable environment possible. I think it's key to make the patient feel like home during their consultation. And for me, it's important to treat all patients with dignity and respect and recognize they're unique individuals. And as such, they might have physical, psychosocial, and philosophical differences that may affect their treatment choices. I think it's also important to listen carefully and work very closely with every patient in order to establish the best plan moving forward, which then allows me to deliver the best possible personalized results to meet their goals and expectations. As surgeons, our time with patients is fairly limited since we spend a lot of our time operating, but that time we interact with patients is precious and honestly something we can never have enough of. Making the most of this time and trying to connect with patients, I believe it allows for better communication and is key for a positive experience. Working in an academic environment, we do see a fair amount of complex and or revisional surgeries from the state of Colorado and surrounding states, and each case is unique and has its own challenges, which is very stimulating and at the same time very satisfying when you can bring hope and joy to that patient. It's even more fulfilling to follow these patients after their surgery and see the impact their surgery had in restoring their form and function.